going to be performing a head-to-toe assessment on you this morning. If you have any questions or anything like that about the exam, please feel free to let me know, okay?
Okay.
I'm going to start just by asking for your name and date of birth.
Taylor Martin, March 24th, 95.
Perfect. And for today's date?
January 22nd, 2022.
Perfect. All right. And so upon the initial assessment, I'm just assessing the client, making sure that they are learning oriented, her speech is clear, assessing her appearance, her behavior, any noticeable mobility issues. I do not notice anything of that nature. Making sure that her abstract reasoning and judgment is intact. So I'm going to ask her, does 1 pound weigh more than 3?
No.
And does a rock float on water?
No.
Perfect. That abstract reasoning and judgment is intact. And now I'm going to grab a quick set of vital signs on you. And temperature. I'm going to palpate your systolic while I watch her respirations. All right, perfect. Respiratory rate of 16, temp of 97.7. Blood pressure cuff is just finishing. All right, perfect. 126 over 72, with a heart rate of 76. Alright, I'm now going to start the head-to-toe assessment, starting with just inspection of her scalp and skull, assessing for any abnormal contours, lesions, hair distributions, anything like that. Everything appears to be normal. I'm going to now palpate using my hands, inspecting her hairline and her scalp, assessing again for any masses or contours. No abnormal findings there. Everything seems to be within normal limits. Going in now to assess her external eye, looking at her lashes, her lids, her conjunctiva, making sure they're nice and pink, which they are, and her sclera is nice and white. No signs or symptoms of infection or abnormal drainage there. Going to now be doing assessing your nearsightedness using the Rosenbaum chart. I'm going to have you cover one eye, holding the card 12 to 14 inches away, and read the lowest line you can for me.
4, 2, 6, 7, 3, 9.
Perfect. Other side.
4, 2, 6, 7, 3, 9.
All right, and then all together.
4, 2, 6, 7, 3, 9.
Great. And those results yield the client with 20/20 vision. Prior to this exam, I know this, I'm familiar with this client. I know that she does not wear glasses, but in an exam when I was not familiar with the client, I would ask them if they wore any type of corrective lenses prior to doing any of my eye exams. I'm now going to use my ophthalmoscope. Assess her pupils, making sure they're brisk and consensual equal to light. Perfect. Checking for accommodation. Gonna have you look straight ahead against the wall behind us. Good. They're brisk, equal, and reactive. 3 millimeters and round. I'm now going to be assessing her red light reflex, assessing her optic nerve, looking at the vasculature in the back of her eye. Using my ophthalmoscope, I'm going to go from my right eye to the patient's right eye and my left eye to the patient's left eye. So starting with her right eye, I just position my hand like this. Find her red light reflex and follow it in. Assessing the optic nerve and the vasculature, looking for any red dots within the vasculature, which would indicate diabetic retinopathy. I do not see any there. Everything looks good. I'm going to do the same thing, going to the patient's, from my left eye to the patient's left eye. Finding the red light reflex and following it in. Again, assessing for any abnormal findings, looking at the vasculature. Everything looks to be within normal limits there. From there, I'm going to just palpate her sinuses for any tenderness. Any tenderness there?
No.
About there?
No.
Alright, I'm going to assess her nose, looking for symmetry, and checking for patency as well. So everything looks symmetrical on both sides. I have 2 different scents right here for you. I need you to tell me, I'm going to have you cover one side, smell, and then we'll do it on the other side, okay?
Okay. Pumpkin.
Perfect,
Lavender.
perfect. Alright. Now I'm going to assess the inside of your nose. Click back on. Alright. I'm gonna have you just tilt your head up a little bit. I'm assessing the inside of her nares for any inflammation, abnormal drainage, looking at her septum and the turbinates. No abnormal drainage, no signs of infection. This looks good. Now we're going to assess your ears, starting just palpating the mastoid and pinna and tragus for any tenderness. Any tenderness there?
No.
Alright, and now I'm going to be assessing your ear. I'm going to be holding the otoscope in the proper hand position here, pulling her pinna up and back, starting with the middle ear canal. Looking for any inflammation, excessive cerumen deposits, anything like that. It is patent, no waxy cerumen present, no signs of inflammation. I'm going to assess her tympanic membrane, looking for the cone of light. Finding the tympanic membrane, and it is gray pearly in appearance, as it should be. Doing the same thing on this ear, pulling the pinna up and back, pointing the otoscope towards the client's nose. Starting with the middle ear canal, again, patent, no cerumen, waxy buildup noted. Looking at her tympanic membrane, again, it's intact and gray pearly in appearance. I'm going to now perform a whisper test. I'm going to have you cover one ear. I'm going to whisper a word, you're going to tell me what it is.
Apple.
Perfect.
Baseball.
Perfect. She passed that whisper test. Now going to be assessing your mouth with a tongue depressor and a light. I'm going to have you open your mouth, say ah, assessing her uvula, her hard and soft palate, her pharynx. Okay, you can put your tongue back in. Her dentition, her tongue, her gums, looking for any signs of infection or lesions. Everything looks within normal limits there. No abnormal findings. From the mouth, I'm going to be assessing her neck. I'm starting looking to see if there's any trachea deviation. Trachea looks midline. I'm just going to palpate. And it is midline. I'm going to palpate for her carotid and both sides, starting one at a time. Note the amplitude of that. Strong equal bilaterally. I'm going to assess for bruit using the bell over her carotid. No bruit noted. I'm going to just palpate your thyroid real quick, standing behind you. And have you swallow. Any tenderness there?
No.
Good. Alright, I'm going to now palpate your lymph nodes, looking for any abnormal findings. Would be enlarged lymph nodes, tender, anything like that. Let me know if you have any tenderness, okay?
Okay.
Starting with pre-auricle, post-auricle, occipital, tonsillar, submandibular, submental, anterior cervical, posterior cervical, the deep cervical chains, and then supraclavicular. Any pain or tenderness there?
No.
Alright, no abnormal or enlarged lymph nodes noted upon inspection either. From there, going to inspect your upper extremities, starting first with inspection, looking for symmetry, any deformities, lesions, anything like that. Everything looks to be within normal limits. Going to touch and assess for temperature. It's warm, equal both proximally and distally. Going to assess for nail beds. For the angle, make sure there's no clubbing, as well as capillary refill, and it's less than 2 seconds on both sides, as it should be. I'm going to palpate her radial and brachial pulses, starting with radial. They're strong, equal bilaterally, radially, brachial. Also strong, equal bilaterally. I'm going to now palpate the lymph nodes in your arms, starting with central, lateral, pectoral, subscapular, and then infraclavicular. Any pain or tenderness there?
No.
All right. For the next part of the exam, we're going to be going into the thoracic aspect of the exam. I'm going to have you just turn. Perfect, that's fine. Noting the AP diameter of her chest, making sure that anterior to posterior is less than 2 to 1. You would be in this portion of the exam, especially with a patient if they had COPD, looking for signs or symptoms of barrel chested. She does not have any of that. Her ratio is within normal limits. So I'm going to start by inspecting for even rate and rhythm, increased work of breathing, even chest rise and fall. Everything looks to be within normal limits. I'm going to just place my hands on her back, again to confirm that. I'm going to be palpating her spinous process and her paravertebral muscles. Those all are within normal limits. I'm going to be auscultating in all 10 fields here. Whenever I place my stethoscope on your back, just take a deep breath, okay? Here I'm listening for any adventitious lung sounds like crackles, wheezing, rhonchi, anything like that. All right, the patient is clear throughout. I'm going to now percuss in all of those areas. Should be like some resonance over the areas of her lung fields, more flat and dull over areas of her scapula and where her visceral organs are. Perfect. All right, I'm going to be checking for CDA tenderness now, over where she would be having rebound tenderness from her kidneys. Any tenderness there?
No. No.
All right, perfect. I'm going to have you swing around to the front. This portion of the exam is where I would be performing a breast exam. On this client, I'm going, in purposes for this assessment, just going to verbally explain how I would do that. Starting with assessing for symmetry, contour, any dimpling, anything like that. Assessing the client in 3 different positions on both sides, both with her arm at her side, at her hip, and then behind her head with a pillow placed underneath her scapula. Doing the 3 different motions of circular, vertical, and then wedge form, starting at the tail of Spence, going all the way into the nipple, assessing for any abnormalities, tenderness, or masses, and then instructing her on how she can perform that same exam once a month, 2 to 3 days after her period, either in the shower or in front of the mirror at home. All right, now going into the anterior aspect of the exam, starting again just with inspection, noting her work of breathing, even rate and rhythm, any retractions, anything like that, none are present. She looks unlabored in her work of breathing. I'm going to auscultate the 8 anterior lung fields. Again, just taking a deep breath. Comparing each side, again. Patient is clear throughout, no adventitious lung sounds noted. I'm going to now palpate her chest, feeling for her point of maximal impulse. Hers is at her 5th intercostal space mid-clavicular line. Noting for any lifts, heaves, or thrills, which would all be abnormal findings. Do not feel any. She's got a palpable, even point of maximal impulse. No abnormal findings there. I'm going to now listen to her heart at the aortic, pulmonic, tricuspid, Erb's point, and mitral, starting first with the diaphragm in all of those areas. Starting aorta over here, and then pulmonic, tricuspid, Erb's point, and then mitral. Going to listen at mitral for 60 seconds, just starting my stopwatch here. Alright. Now I'm going to be listening in all those areas again with the bell. Starting aortic, pulmonic, tricuspid, Erb's point, and then mitral / the apex. Again, listening for S1 and S2 or any abnormal murmurs, none noted. Got even rate and rhythm. Alright, and then from there we're going to be doing your abdominal assessment. I'm going to have you lay down. And then if the clinical setting, if the client was in a gown, I would be placing a drape over her lower extremities when I pulled her gown up to provide her with privacy. Starting the abdominal assessment with inspection, looking for any abnormal contours, bulges, pulsations, anything like that. I do not note any, making sure the client's comfortable. Comfortable? All right, perfect. And then from inspection, I'm going to auscultate all 4 quadrants, assessing for normal active bowel sounds. Great, and she has normal active bowel sounds in all 4 quadrants. I'm going to now listen for bruit over her aorta, femoral, and renal arteries. Starting here, midline of the aorta, and down and laterally on both sides, starting for renal arteries. And then femoral arteries. No bruit noted there. I'm going to now be going into percussion, going to percuss in all 4 quadrants, looking for either tympany over some air-filled organs and then dullness over more visceral organs. Alright, I'm going to now lightly palpate in all 4 quadrants, assessing for any masses or tenderness. Any tenderness there?
No.
Alright, now I'm going to deeply palpate, again assessing for any rebound tenderness, masses. Going up to her right costal border to feel her liver border. Going midline, palpate her aorta. Palpable, strong there. And then palpating bilaterally her femoral pulses. Strong, equal bilaterally there. Alright, and then I'm going to have you lift up and be assessing for any hernia, any abnormal bulging, or anything like that. I do not notice any on this client. Now you swing up. Going to be going into the assessment now of your lower extremities. Again, starting with inspection, looking for symmetry, any signs that would give her mobility issues. I do not note any. Going to touch, feel, make sure that her extremities are warm. They are. Assess her capillary refill, both sides, less than 2 seconds, which is great. Just move on. Going to assess her post-tibial pulses here. Those are strong, equal bilaterally. Again with her pedal pulses. Those are also strong and equal bilaterally. going into, if this was a male client, the male genitalia portion of the exam, where I would be assessing their vas deferens, their testes, scrotum, urethral meatus for any abnormal drainage, masses, tenderness, anything like that. I do not, and if I did not note any, teaching them how to do monthly testicular exams at home in the shower, and noting again, palpating for any masses or abnormal changes there. And that is the conclusion of the head to toe physical assessment. I'm going to now assess the cranial nerves. Starting first with olfactory. I again am going to do the smell test with you. Close your eyes and tell you what the smell is. You tell me what the smell is.
Lavender.
Perfect.
Pumpkin.
Perfect. All right, and then 2 is optic. I'm going to be checking your visual field for confrontation, okay? So I'm going to have you cover one eye, look directly at my right eye, okay?
Okay.
And then you can tell me what numbers I'm holding up, okay?
2, 1, 3, 2, 1, 2.
Perfect. We're going to do the other one. Again, keep your eye here.
2, 1, 2, 2, 1, 3.
Perfect. All right. She's had normal findings for that portion of the exam. I'm not going to be doing the cover-uncover test, so I'm going to have you just look straight ahead at the wall. I'm just making sure that you're, for your pupillary accommodation, okay? Making sure that once uncovered, both the covered eye and the non-covered eye are equal and consensual, which they are there. Perfect. Both are equal and reactive when covered and uncovered. Now testing cranials 3, 4, and 6, oculomotor, abducens, and trochlear. I'm going to have you watch my finger, and I'm going to go through your 6 cardinal views of gaze, and then assessing for any lateral strain and nystagmus as well, which would be abnormal findings. All right. Perfect. No nystagmus noted. No straining. All seems to be within normal limits. And then 5 is trigeminal. So I'm going to be having you clench your teeth. I'm going to feel your temporal here, and then your masseter muscles, checking for evenness. Make sure that they're round. Good, and they are both strong, equal bilaterally. I'm going to be checking your sense of soft and sharp on your forehead and your cheeks as well for this portion, okay? So you close your eyes, tell me if it's sharp or soft.
Soft. Sharp. Sharp. Soft. Soft.
Perfect.
Sharp.
Perfect. All right, she missed that one at the end, but then with a repetition, she was able to get that. All right, going from 5, we're going to 7, which is facial. I'm going to have you smile really big, frown, puff out your cheeks. Perfect. All of those are intact. 8 is auditory. I'm going to be performing the Weber and Renee test. Starting first with the Weber, I've got a tuning fork here. I'm going to be striking it and then placing it on the center of your skull. You tell me if you hear it stronger on one side of your ear or
Okay.
not.
No, it's equal.
Equal, perfect. Those are normal findings. Second one is the Renee test. I'm going to again strike it, place it on your mastoid bone, and then when you stop hearing it, let me know. I'm going to move it to the outside of your ear canal, okay? What I'm assessing for here is bone conduction versus air conduction. Air conduction should be twice the bone conduction. And I've got a stopwatch here.
Stop. Stop.
Great. And again, normal findings. Her air conduction is twice of her bone conduction. Doing the same thing on this side.
Stop. Stop.
Perfect. And again, normal findings. She has twice air conduction than bone conduction on this side. 9 is glossopharyngeal and vagus. I'm going to be checking your ability to swallow, your gag reflex, and your uvula, okay?
Okay.
All right, open up and say ah. Perfect, and check your gag reflex. Perfect, gag reflex is intact. Now have you just swallow. Perfect. 11 is spinal accessory. I'm gonna have you shrug against my hands here. Perfect, assessing the strength, and then lean your hand hand against this, my hand over here, and then over here. Perfect, those are all intact. And then 12 is hypoglossal. I'm gonna have you stick your tongue out, and then stick to the roof of your mouth, and then side to side. Perfect, all right, that is intact. And then now we're gonna be going into the musculoskeletal portion of the exam. I'm gonna have you stand up. I'm gonna assess your iliac crest and your shoulders here for alignment, making sure that they're symmetrical both anterior and posteriorly, which they are. I'm assessing the curvature of your cervical, lumbar, and thoracic spine. All of the curvature seems to be within normal limits. I'm gonna have you bend over. Perfect. Assessing for scoliosis, any abnormal curves, making sure her alignment is correct. Good. You can stand back up. No signs of scoliosis there. Be assessing the strength of your TMJ. Open your mouth against my hands here. Perfect. Nice and strong. Up against my hands here with your sternocleidomastoid and trapezius. Good. And then I assessed your cervical with the spinal assessment earlier, but I'm going to test your range of motion with your cervical spine. So can you rotate your cervical spine for me? Perfect. And then laterally one side to another. Good. And then we're going to assess the trunk of your spine. So I'm going to have you, we already had you kind of flex down this. So can I have you hyperextend? Good. And then rotate. Good. And so she has full range of motion in all areas of her spine. Good. And I can have you sit back down. I am going to be assessing your upper extremities now, starting distally at your fingers. Inspecting for any pain, crepitus, anything like that. Any pain?
No.
Right, no crepitus notice. Starting with her fingers, going to her hand, wrist, elbow, and shoulder on both sides. Perfect. All right, I'm going to have you hold your hands out like this. Adduct and abduct your wrist like this. Perfect. Have you make a fist. Good. And open. Have you grab my fingers, noting her strength. Good. And then I'm going to have you flex your wrist down and then up. Perfect. And then I'm going to have you pronate and supinate, assessing the range of motion of her shoulder, or her elbow rather. And then for your shoulders, I'm going to have you lift your arms straight up, and then bend your hands behind your back, and then flip them down like this. Great. She's got great range of motion of her upper extremities. I'm going to test her muscle tone and strength. I'm going to have you pull up against my arms here. Good. And then press down. Good. And so she's got full range of motion, great muscle tone, and then 5 out of 5 strength in her upper extremities. And then from here, I'm going to assess muscle tone, range of motion, and strength with your lower extremities. Starting with your toes, again, inspecting, palpating for any pain, crepitus, or tenderness. And then for range of motion, I'm going to have you press up, press down. Good. Press up, press down. Good. And then flex your ankles for me. Good. All right. And then I'm going to have you lay down. Going to assess the range of motion with your knees and your hips. I'm going to have you lift your legs straight up. Good. And then the other one. Great. And then I'm going to have you take your knee like this and bend it over the other one. Perfect. And then same with the other one. Great. All right. You can sit back up for me. She's got great muscle tone and 5 out of 5 strength with her lower extremities as well. And that concludes the musculoskeletal portion of the exam. We're now going to be doing the cerebellar and sensory portion of the exam, which is the last part of the exam. So I'm going to have you stand up and have you walk a few steps out that way, turn around and walk back. I'm noting her posture, her gait, looking for any imbalances. Perfect. She has no imbalance issues there. Now I'm going to be performing the Romberg test. I'm going to have you cross your arms over your chest. I'm going to start my stopwatch. I'm going to have you stand like that for 30 seconds, okay?
Okay.
Assessing again for any swaying or her being unable to hold this position. And then after the 30 seconds, I will let her know, and I'm going to have her close her eyes. All right, you can go ahead and close your eyes. Again, I'm noting for any swaying, having my arm in close proximity to her just in case she were to lose her balance. I could protect her and keep her from falling. All right, you can open your eyes. I'm going to have you now walk toe to heel, a few steps out that way, and then turn back around. Again, assessing her sense of balance. Good. And turn back. you stand on one foot for 5 seconds. Good. All right. 5, 4, 3, 2, 1. Good. Nice. 5, 4, 3, 2, 1. Perfect. She was able to successfully complete that as well. Now I'm going to be assessing your fine motor skills, so you can go ahead and have a seat. We're going to start finger to thumb, have you go all the way down, all the way back. Perfect. She executed that well. I'm now going to have you take your finger to my finger and then back to your nose. Good. Other hand. Good. Her fine motor skills are intact there. And then from here, I'm going to be assessing her sensation of her upper extremities. First, making sure that she can, palpate, touch, or feel my touch here. Can you feel my touch there? Good. We'll be assessing, making sure she can feel sharp in touch, both proximally and distally. Gonna have you close your eyes. Tell me if this is sharp or dull or soft. Okay.
Dull. Dull. Sharp. Sharp. Dull. Dull. Sharp.
Perfect. All right. She scored 100% on that. I'm going to now be testing to make sure she can sense the deactivation of this tuning fork for vibration on her upper extremities. First, making sure that she can feel it. Can you feel that?
Yeah.
All right, close your eyes. Tell me when it stops.
Stopped.
Perfect. All right, we're going to do the same on the other side. Can you feel that?
Mm-hmm.
All right, tell me when it stops.
Stopped.
Perfect. All right, now I'm going to be doing the same thing with her lower extremities. Starting with making sure that she can sense my touch here, both proximally and distally.
Yes.
Perfect. All right, and then I'm going to have you tell me when it is dull or sharp, okay?
Okay.
Close your eyes.
Dull. Dull. Sharp.
Good.
Sharp. Sharp. Dull. Sharp.
Perfect. And then I'm going to be assessing, again, her ability to sense the deactivation of the tuning fork on her lower extremities. You place me on her big toe. First, making sure she can feel it. Can you feel that?
Yes.
All right, tell me when it stops.
Stopped.
Perfect. All right, go to the other side. Can you feel that?
Yep.
All right, tell me when it stops.
Stopped.
Perfect. All right, I'm going to be checking your deep tendon reflexes right now. Starting first, we're going to start with your bicep. I'm just going to strike it over my thumb, noting for reflex in her bicep. Oh, perfect. All right, and then we're going to do tricep. Make sure that her arm is nice and dangly down here. Perfect. And then we'll do brachioradialis. Just have you rest your arm right down there. Perfect. And then we'll do patellar here, making sure that her foot is not touching the ground. It's dangling nice and soft, which it should be. Good. And then Achilles. Great. All of her deep tendon reflexes are intact and normal on the left side. I'm going to now go to the right. Starting with bicep. Just relax this arm out nice and soft. Good. Good. And then brachioradialis. Good. And then tricep. And just make sure that arm's nice and soft. Perfect. And then patellar. And then Achilles. Good. And I'm checking her plantar and Babinski reflex. Good. Making sure if they were her toes were to go out and up, that would be an abnormal find. We want them to flex down. And then I'm going to be, the last part of the exam, I'm going to be checking your stereognosis, your ability to sense different objects in your hand. So I'm going to have you close your eyes. And tell me what this is.
Glasses.
Perfect. Over here.
A pen.
Great. And then last part of the exam is graphysthenia. I'm going to write a letter in your hand. You're going to tell me what that letter is.
Okay. B.
Yep.
4.
It's a letter.
Oh. F.
Yes. Alrighty. And so that concludes the portion of the exam. Do you have any questions for me?
No.
Alright, thank you so much for participating.